Hey guys, welcome back to my channel. I am the Nursing Jewel, aka RubyC, and today I'm going to do a video on my experience at clinicals for my Med-Surg rotation, so stay tuned. Okay guys, so if you've been watching my vlogs, you know that I just finished my clinical rotation for Med-Surg 1. I finished like 2 weeks ago, and then I took my Med-Surg final last week. I passed Med-Surg with an A. And so I thought that I would come and do a formal video on how my experience at Med-Surg was, just like how I did my experience at Fundamentals Clinical. Okay, so Med-Surg Clinical was definitely not my favorite clinical rotation. I thought Fundamentals, I thought I didn't like Fundamentals Clinical rotation, but Med-Surg, I don't know. Yeah, so the main difference between the Fundamentals Clinical Rotation and the Med-Surg Clinical Rotation, number one, for our school, Med-Surg was actually counted as a grade for this clinical. So, like, you're getting a physical number grade for clinical. For Fundamentals, it was pass-fail. So you could do the bare minimum, which some people did do, and you could still pass Fundamentals rotation. Clinical, it'll just be deducted off, and if you get a 75, you fail clinical. So, yeah, so for Med-Surg, also the difference was the care that we got. Well, the care that we got to do. So for Fundamentals, the main focus of clinical was taking care of one patient, doing bed baths, knowing how to take vitals, and basically, and checking pulses. And that was really it. So for Fundamentals, that's what we did every day, all day, or we would watch wounds being done, but we never got to do it ourselves unless the teacher was there. And for Med-Surg, it was more independent. Like, you can't spend the whole clinical rotation just doing a bed bath. You have to do the meds, you have to do wounds, you have to do the vitals just like that. Everything is very faster paced with Med-Surg Clinical. So for Med-Surg Clinical, a typical day would be, we come in, we would meet our teacher at an area, and we didn't even do a pre-conference. That was another difference. For Fundamentals rotation, we always did a pre-conference. That'd be like 10 minutes of us just like learning about our patient, what our teacher expected, yada, 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 and then we go on to the floor. Med-Surg, we got there, our teacher yelled out a room number, told you that's your room, and then you're out. You're gone. That's it. There's no like, oh, this person has this diagnosis. They usually have that. No, she wanted you to find out all for yourself. Like, that was your patient. So you have to go out and find out that information. So, yeah, we would go in. She would give us the room number. Immediately, we would go check on our patient. That's the first thing you do. You check on your patient. In Fundamentals, it used to be like you go to the nurse first, and then you check the chart, and then you check your patient. No, this time you check your patient first, because you could do all that stuff, talk to the nurse, check the chart, walk in, and your patient is dead. So, yeah, she always made sure to tell us to go to our patient first. So you go on the patient, check on them, knock on the door as usual. Hi, my name is Ruby. I'll be your student nurse today. Is there anything I can help you with? Usually, what happened a lot for Med-Surg rotation was that our patients were always done getting dressed. So it's like maybe they were eating or they were watching TV, so they'd be like, no. Or sometimes they weren't done getting dressed. It always depended, but usually they were done. And the other big difference is that they were verbal. For Fundamentals, our teacher gave us patients who couldn't talk or very limited verbal communication. And so I would say, to me, it was a lot easier to do. With someone who could talk, you could say, okay, I'm doing your bed bath now. And they say, no, you have no choice but to wait. And that kills time. So, yeah, definitely having verbal patients was a lot harder. But then it was also a lot easier because they could tell you, oh, I have pain here. Oh, I didn't get this for the day. Can you check on this? Like, they knew what needed to be done. So that was another bonus. So you go in, you check your patient, make sure they're fine, and then you go to the nurse and you get report. And so when you get report, same thing as what happened with Fundamentals. The nurse basically gives you just a gist, not even, it's a little bit different, but basically like, oh, if your patient has a G-tube, they would say, okay, so you could do all the care today. Make sure you check the G-tube site, make sure you flush the G-tube, and the person has to go out to rehab at 10:30, so make sure they're done by then. And then you go on your way. And so after you would talk to the nurse, you would go check your chart. And this is the part that a lot of us had trouble with. So last semester for fundamentals, checking your chart, it could take up to like 15 minutes, I would say. 10 to 15 minutes to check your chart, just because we want to get every little detail. My teacher this semester, she said if she catches you at the chart longer than like 2 minutes, she's deducting points off your final grade, because in the real world, you're not going to spend that much time checking the chart. You need to go to your patient. So, yeah, that was the main difference. And also, this semester we had to look at the meds, because we were actually doing meds this semester. So fundamentals, we didn't look at the med orders at all. It was just like, oh, your patient's code status or diagnosis, stuff like that. This semester you add the meds in, and you have to know what time the meds are given and what the meds are given for. And so that was like, we had to write a whole list of each med that the patient had in less than 2 minutes, know all their diagnoses, just know everything. And then we were on our way. Some patients would be done, you would just take them to rehab, or you would do their meds if they had a G-tube, or you just be around them and see if they have any needs. Yeah, if they had a bed bath, your bed bath had to be done like that. You had to know, oh, that's the other difference. Last semester, our teacher was always on us about everything. He would come in like at least every 10 minutes. You know, every 10 minutes you would see the teacher, and he'd be like, what are you doing? Why are you doing that? What's this? What's that? And so we always knew that he would come by. This semester, it was a lot more independent, because our teacher knew that if you pass fundamentals, you know how to give vitals, you know how to do everything. So just go out and do the care. Like, she's not going to pressure you or anything. She will always be by the nurse's station, if anything. The only time she would really bug us is if she's like, okay, I want you to do an injection today. That's when she would come find us. But other than that, she left us alone to do whatever. So you were that patient's nurse for the day. If they needed anything, you had to take care of it. So, yeah, so we had to know meds. So you have to finish up the bed bath. Say if a patient needs meds by 9 a.m., she's not going to come find you. Our teacher did not come find us and say, oh, your patient has a med due at 9. You had to know from looking at the chart that your patient is due for this med, how many meds, at what time, what route, and what it's for, and what you have to do before you give the med. So say if it's something that's given for hypertension, like metoprolol, which is a beta blocker, you know that if you're going to go give it to the patient, you have to check their blood pressure first, because if their blood pressure is already low or at a good rate, you don't want to give something that's going to lower it significantly depending on the amount of the dosage. So you have to know all of that, and she expects you to know that. So it was definitely a lot more independent this semester, and it was a lot more pressure, I would say. Even doing wounds, if your patient has a wound, it's expected. You're not going to ask your teacher, oh, should I do the wounds? Or you shouldn't go ask the nurse like, oh, should I do the wound? It's expected that if you see that your patient has a wound, you're doing the dressing change, or you're doing the dressing change, or you're cleansing it and stuff like that, or you're checking the G-tube, you're flushing the G-tube if you see a G-tube. If you see anything there, you're expected to do it. That's how Med-Surg Clinical went compared to fundamentals, where it's our teacher always telling us, okay, you're going to do that. Don't do this unless I'm in the room. Call me when you're ready to do that. No, it's boom, just do it. So, yeah, so after our day would be done, we would basically finish. Clinical started at like 8. We would be done by, I'd say 10:15. And the difference from fundamentals is that you're expected to do other things now. Fundamentals, we spent the whole clinical, like I said, doing bed baths, taking vitals, and everything. And then we would have post-conference, talk about how well it went, and then go home. But for Med-Surg, it's like you take care of your patient, and then you're expected to go to a nurse and ask if she needs any help with anything. Do blood sugars for the floor if you're done with your patient. go to the dining room and see if they need help, transport a patient to rehab if they need it. You're expected to take initiative and go out and do something like you're a nurse. So the problem with that for me was that there were so many of us on the floor that by the time I would be done, or by the time I find something, everyone is hopping on it so they don't get in trouble. So then there would be nothing to do, and then our teacher's like, what are you doing? So we would usually get in trouble for that. If you watch my videos, you know that I always complained about getting in trouble or hiding. I always talked about hiding just because there was nothing to do on the floor. So that was the only minus side. And I think to combat that, maybe 2 patients. But yeah, maybe giving us 2 patients would have helped. But there was definitely a lot of downtime, and our teacher didn't want us to go until like 12:30 or 1. So just imagine from being done at 10 and then trying to kill time to 12:30 when there's nothing to do. You keep asking the nurses and they're like, oh no, you're fine, there's nothing. Like, that kind of got complicated. So then once we were done, once the teacher saw that everyone was done, we would have post-conference. And so post-conference, you would basically give like a SBAR, situation background, or like report on your patient to everyone as if they didn't know who that patient was. So you would go in and be like, 19-year-old male, admitted on October 2017 for hypertension, DM, COPD, history of this. He has the G-tube site on the right lower quadrant. Like, all that, you would do that. And then we would also give the meds and say, okay, this patient is on this med for hypertension. This patient has insulin for DM. This patient has eye drops for this, or for glaucoma, or you just have to keep going. And our teacher always made sure to question us, why is the patient taking that? What's the generic name of that medication? What's the brand name? You have to know. And so it definitely taught a lot about the medications and what they're for, knowing what it's for, knowing why you're giving it. Don't just give it because you see the doctor's order, because doctors make mistakes. As a nurse, they always told us that never just trust a doctor or trust the order just because the doctor wrote it down, because you're the one that's giving it. They won't say like, oh, the doctor wrote it down, so the doctor gets in trouble. You're the nurse. Why didn't you know to not give that med? So our teacher always made it a point to question us why we were given the med, what it was for, what's the other names, like what it's supposed to look like, what's the route, how many degrees if it's an injection. Always know. So yeah, that's basically how a typical Med-Surg clinical rotation went. And so yeah, that was pretty much it. I ended up getting a 92 in Med-Surg clinical, which I was happy about. And I did learn a lot. I did wound dressings. I did an injection, which was very scary for me. I did the meds through the G-tube site, which was definitely different for me, but I kind of enjoyed it. So I did learn a lot in the Med-Surg clinical rotation. It just wasn't my favorite, just because I'm not a nursing home person. Our Med-Surg clinical was in a nursing home rehab center, and so for Med-Surg, we usually stayed in the subacute. So that's usually someone who's there for like an accident or something like that, or like a minor injury. They'll be going home soon. That's where our patients were from. And compared to fundamentals, our patients were like long-term care for fundamentals. So yeah, it wasn't my favorite rotation, but I definitely learned a lot. And so now I have started OB, maternity, and so I can't wait for that, and I'll definitely come back at you guys with another type of video like this. Let me know if you have any questions, and hopefully I'll answer them. And thank you guys for watching. Make sure you stay tuned and keep up with my vlogs. And if you like this video, give it a like, comment, and subscribe. Thanks, guys.